It was.
I know. I remember the wall was giving it to a couple of people. Was it like that? Oh yes, across. Thank you.
And then like this.
Yes, I was like, I know there was something really like.
We are live. Everybody say hi.
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 Welcome to our workout.
Welcome to our warm up.
All right, you guys ready to listen to some good music? Yeah, I feel spicy today. I don't know.
I'm always feeling spicy.
I've been in on this song lately, and I don't know why. I don't know. It's just been my game. All right, y'all. What up? Welcome to Fitness Friday at Inside Track PT. We are currently warming up. I had a workout this morning. I played some basketball, so I'm a little sore. So I'm gonna need probably a little extra time. But our workout today, if you would like to try it, is we are going to do a 4x8 of our power clean at about 80% of our 1 rep max. If we don't have a 1 rep max, we are going to do, it's usually lagged behind, but let's keep an eye on that. We're going to do a 4x8 80% of our 1 rep max. If we do not have a 1 rep max, we are going to do 8 on the RPE scale, which means we get to the last couple of that 4x8 and we're like struggle bussing. And then we're going to do a 4x10 superset of barbell overhead press and strict pull-ups or ring rows, depending on what you would like to do today. So that's our workout. What we're doing today for our talk while we're doing this is we are talking about the pelvic floor. We have a new pelvic floor physical therapist. Yay! And she's going to be primarily the one who's talking today. Yay, not me. But we are going to be talking about the pelvic floor, what it is, why we treat it, why it's important, why you should care, what issues you could be having that you didn't really realize until we talked about this. And normalizing some things, well, I would say denormalizing some things that a lot of women in particular have dealt with for a very long time and letting them know that they don't have to keep dealing with it. Is it working now?
Yeah.
Sweet. Okay. This one, like my music's just slapping today. All right. So, per usual, as this live is on, if you come on and you have questions for us, put them in the chat because we can see. I should actually turn the computer around. But we can see the chat if you have questions about pelvic floor, especially as it pertains to exercise. Let's see. Chat. So, one person's watching. Hi, one person. How are you doing? Thanks for watching with us. Nobody watched last week, so it's kind of exciting when someone watches. Okay. So yeah, if you have questions as we're talking about the pelvic floor, put them in the chat. We can see the chat. And we will answer those questions. But today, what? Never miss a comment. Okay. Display it on the screen. Oh, okay. Sounds good. Anyhow, so let's start with, we have a couple questions to get us going as a staff. Brought to you by Nicole because she's awesome. Also, I don't know if I've told you this, but I've been calling you Master Nicole.
Yeah.
Because the other three of us have our doctorates, and you have a doctorate level of education, but not the degree that says you are a doctor. So I've been calling you Master Nicole. Nicole got her degree
Almost 24 years ago.
almost 24 years ago. And it only became a doctorate level of education like
2 years at my school. It was 2 years after I graduated.
Oh, okay.
So I graduated in
So it was like
02.
15 to 18 years ago.
Yeah. Yeah, it turned into a doctorate program in 2004 or 5. But there were 2 classes behind me that still got their masters. And then it just transitioned.
Yeah. Anyhow, I thought it's been fun because like I kind of like Master. Master Nicole is kind of fun.
Yeah.
Okay. What are the pelvic floor muscles? That's our first question.
It's a good question. A lot of people wonder about that because a lot of times when people think about pelvic floor, they think about peeing themselves. And people use all sorts of muscles to try not to pee themselves, like squeezing their necks together, squeezing their buns. Yeah. But the pelvic floor muscles are actually the muscles that are at the base of your core. They attach from the pubic bone in the front to the coccyx, which is the end of your tailbone, and out on the sides to your ischial tuberosities, which is those bones that you sit on when you sit. Yeah. Are you showing
the pelvic floor
Jana's
model.
showing the
It's
pelvic
in the
floor
corner of your
model.
screen.
Yeah. So I just sent them a Cleveland Clinic article yesterday, and it said the pelvic floor is made up of 14 muscles. And I was like, what?
You're like, wait.
By my count, it's maybe more like 10. But, certain parts of the muscle, they rename. Yeah, they rename. So, but the main ones are going to be your levator ani muscle, which is kind of an infusion of 3 different muscles. They intertwine and they make this kind of butterfly shape. I don't know if it's a butterfly, more like a stingray, maybe. And those muscles are what help you not leak urine when you don't want to. They help you hold in your gas. And they also have to relax when you have a bowel movement or you have to urinate.
Yeah, right. So
or have a baby or I don't know, lots of different things. All right. Did that answer it? What are the pelvic floor muscles?
Yeah. No, I think that was great.
So the main muscles are called levator ani. That's made up of 3 different muscles. Those are the ones that usually can hold your pee in when you don't want to urinate. It can hold in your gas and hold in your bowel movements until you're ready to go. And then you also have your coccygeus, which contributes also in the posterior region.
Now,
Talked about at the base of your abdomen.
It's the base of your core.
Oh, you already said that probably.
Yeah.
Just couldn't hear you up there.
but
No.
saying that it's the base of your abdomen makes more sense because most people, and it's interesting is most people don't recognize that they're abs. They're just like our abs, but our abs go down like all the way to our pubic bone, right before we get to our crotch, basically, and then like everything underneath us, like the floor of our body, of our trunk, which.
What?
I've heard people describe it as like a sling.
Yes.
Hammock.
So the pelvic floor muscles do act like a sling in that they do hold up some of your organs. They hold in place your bladder, part of your large intestine, your bowel. In women, their uterus. It especially supports when they're growing a baby in there. And in men, it supports their prostate.
And when you're pregnant and baby's getting pretty big, it's a little harder. It gets a little workout the last 3 months when you're, carrying all that weight.
Yeah.
Not that I'm speaking from experience or anything.
Yeah. And then those muscles have to really relax and stretch in order to give birth to a child. So a lot of times you can develop some dysfunction after you have a baby because of that.
And if you're wondering, the difference between a pelvic floor therapist and let's say a general orthopedic or a sports rehab physical therapist is when I talk about the pelvic floor with people, I know what those different muscles are, but I'm less familiar with them. So hearing the levator ani for keeping your pee and your bowel and bladder stuff, I don't know those specifically as well as Nicole does, which is why she's here. Also, when I talk about the pelvic floor, I talk about the reason it's important is that for men and women, it's just more common that women deal with it because we have the babies. I always talk about the pelvic floor in terms of the 6 layers of the core or the 6 sides of the core, which is abs, back extensors, obliques on the side, diaphragm, and then pelvic floor. And so if that complex is not locking up together to brace when we lift heavy things or we push something or we bend down to get something, then we can have problems from that, whether that's back pain, hip pain, leaking, loss of control of bowel and bladder, difficulty with bowel movements, pelvic pain or pain with sex because we've developed bad, not compensations, coordination, bad coordination, and then weakness, tightness, and weakness.
Yeah, a lot of the times in some patients that have pelvic floor dysfunction, it's not, most of the time, it's not that they're weak, it's that their muscles can't relax. So they get tired. So any muscle that is not able to relax eventually will get fatigued. And it's that fatigue that usually causes that leaking or that lack of continence.
Just
that
like
you
when we
have.
talk about your upper trap or your hip flexor.
Yeah.
Same exact thing happens. For the
Exactly.
People just get more uncomfortable about talking about it.
Yeah. And then other things can happen too. When you have a pelvic floor that's not functioning, you can also have prolapse, which means I was holding this the total wrong way.
What?
You can also have prolapse. I was holding it the total wrong way.
Oh,
You can also have prolapse, which means that your organs fall down below where they're supposed to be, like your uterus, even your bladder, and even your bowels can. And it's really hard once it gets to a certain stage for me to rehab that. It's a lot easier for me to help you reverse that in the beginning stages than when your uterus is falling out of your body.
which you made that connection, but I'll ask for everybody else. What is prolapse?
Prolapse is any time that your uterus, bladder, or even your bowels are not in the correct position and being supported by the pelvic floor muscles properly.
All right. Huh? Yeah, I was thinking that we'd probably move 2 of them, so we have 3 platforms to lift from. Because I wasn't sure, Haley, how much you are gonna do hang clean today. Okay. There you go. Ooh, look at you.
At least I think that's the term. You know me and my CrossFit vocabulary. I'll show you what I did and you can tell me what it's all.
Okay. Will do. Will do. I don't even know what my 80% on power clean is right now. I'm gonna find out. Let me show. Okay, so we talked about prolapse. What does prolapse feel like? Like if someone's like, I don't know if I have prolapse. What do you mean? How would we rule that in or out?
So in women, prolapse usually feels like a heaviness or a lot of pressure in the lower abdomen. If their prolapse is at a certain stage, a progressed stage, they can even have things that are coming out vaginally, tissue or other protrusions. You can also have a rectocele, and that's when it's coming out the rectum, and that would be your bowels instead of your uterus. And your bladder can also drop too. So, but it usually feels like kind of like a heaviness, a pressure. Sometimes they have trouble urinating or having a bowel movement because of that pressure or because of that blockage.
Which y'all, can we just say like that's crazy? That women have just been, huh? So I can see the 3, like where you're gonna be, and then the middle and the.
Okay, yeah, you're good.
So when I graduated from school, most women with a prolapse, they would do a sling surgery. 24 years later, we all know that sling surgeries have failed. Lots of women had sling surgeries. They're now having problems again. It wasn't a forever fix. And then there was also other medical complications that went with it.
We're in between. Just put it here.
I've had lots of stage 1 and 2 prolapses that have rehabbed really well, and they haven't had to go on to have any sort of surgery or go on to even something non-surgical like a pessary. And a pessary is just like a plastic ring that goes in and holds everything up.
How effective are those? Do you see?
How effective are those? I've seen several,
Pessaries?
but well, not
I mean,
seen them. But.
I should actually look at the research on that.
Sorry.
I haven't looked at the research on that but it feels to me like they don't work great because everybody I see, they failed. But probably if they're working, I don't get to see them. So
Gotcha. Yeah.
I don't know how, but I do know that I read a study that said more than 3/4 of patients get better with pelvic floor therapy. It was almost up to 80%.
That's awesome. So really
Not
effective,
just with prolapse, but with
really
incontinence.
effective treatments. You can get better. So never think,
It's always worth a
I
try.
pee a little when I run. It's normal. I had kids. Don't assume that. Come get help.
Right.
Or it's just, I'm a woman. You know, I had kids. It's just how it's going to be. Do you hear that a lot?
There's no reason to have pee coming out when you don't want it to.
Truth.
Ugh. I honestly find it so annoying that like that's been the history of like for women is that like you have a baby and because God forbid we talk about anything sexual in real life like the pelvic floor, even though you were in a room full of other people helping you give birth to this person so that way we could bring life into the world, then we stop talking about it. Like I really hate that, but that's part of why I like pelvic floor therapy so much. I do external pelvic floor work. So what that means is that I don't do what Nicole does, which is more detailed, more complex issues. And she does internal work, which means that she can help people internally with those muscles which talk about that a little bit, why internal work can be needed and why external work can also be helpful. Because I know you do internal work with people, but also external work with people. And how do you differentiate? Like I just do external work and you're teaching me stuff all the time. But why would you do internal or external or one or the other?
Well, the muscles of the levator ani and a little bit of your obturator internus, if they are hypertonic, which means they're not relaxing properly, it's really hard for somebody to figure out how to relax those on their own. So what I do is I go in manually and I push on those muscles. Muscles just physically can't stay contracted against a force. So when I find a tight muscle, push on it and try to get improved relaxation. So that's usually what I do when I do internal work. I'm most of the time doing manual releases, trigger point releases, trying to get those muscles back to baseline relaxation so that when they do their exercises, they can get more mileage out of them. Did that answer it for you?
You might not want to have that on when you do this.
Yeah, true.
Now, what I would add to that when it comes to when we're deciding if we're going to do internal or external work is one, it's always dependent on what the patient wants or feels like is going to be most beneficial to them. To be honest, a lot of women have had like sexual trauma of some kind, and some of them don't want to do internal work because of that. And that's completely appropriate. We will not do internal work if you personally are not comfortable with it. And there's lots of things we can do externally. So we don't even have to get to that point. Is it helpful so that way we can move things along a little bit faster? Yes, always. But if it's going to make you worse because it's going to make your anxiety higher or bring back trauma, then we don't do it. Just starting there. I know for me personally, pelvic floor work, like I have different ways that I rule it in or out. So Nicole brought up like leaking or feeling like you have pelvic pain or pressure or even seeing tissue coming out through the vaginal area. Specifically, like women seeing tissue coming out of the vaginal area can suggest prolapse. A lot of times, the majority of what I rule in and out is going to be leaking specifically. And then also I look at a lot of, if I know any woman comes in to see me and they've had a baby in the last, if they're having back or hip pain and they've had a baby in the last 20 years, if they've had a baby ever, I'm always checking for diastasis or diastasis. It's like libero. You can say it a lot of different ways. It's Latin. So say it how you want to. But for you, Nicole, or Jan and Haley, right? I know for me, when I'm checking diastasis recti, that's where I've got, my linea alba, which is the name of the tissue between the abs, like the two sides of the abs. There's tissue in between that too, but the up and down tissue, it gets really stretched out when you have a baby because your belly gets really big to accommodate for that. When you have baby, it doesn't always snap back together all the way. And if we're dealing with pelvic floor and the abs not coming together the way they should, that can cause lots of problems because we're not stabilizing from our core, coordinating that and strength wise correctly. And then we can cause stress on the back of the hip. So I check diastasis kind of a lot in any of my women who have had kids and I'm dealing with a back or hip issue because it can play a role. So for you guys, when you have someone who's like coming in with diastasis, what's some of the things that cue you to be like, I should check this? And when is it a problem versus when is it like, well, we just need to do some more abs versus when is it like, we need to go see a doctor because we might need surgery for this?
I've never had anyone I recommended go get surgery for. So
Me
I
neither.
don't think I've seen enough maybe to see the extreme case.
Yeah, me neither.
But in the times that I have where they're having symptoms of some sort, which is why they're still having some symptoms, they're gonna come see me. Is like 3 or 4 fingers, even when they're trying to engage.
Ooh, 3 or 4.
Right.
Rough.
So like you're definitely verging on like that's probably a problem.
Yeah.
Most likely. When it's like 2 or 3 or like 1 or 2 and they're engaging well, I'm not usually as concerned about like that coming together because there will be some separation after having a baby that lasts. It's not going to be the same as it once was. There'll be some sort of change, and you guys can correct me if you feel that is different or wrong from your experience, as long as they're not symptomatic.
Yeah, and the reason why rehabbing a diastasis is important is because it can lead to other herniations and things like that if it's not taken care of. And then beyond that, it just cosmetically doesn't look great, right? So the other thing to think about, I'm out of breath. I did like 3 of those. The other thing to think about is that your pelvic floor is the base of your core, right? So when you're trying to strengthen abdominal muscular and draw it together, you're going to be putting a lot of downward force on that pelvic floor. So knowing how to activate your pelvic floor is really important because I've had patients that were just coming in for diastasis and they ended up with a prolapse because of it. So they were coming for diastasis and then eventually it's like, I'm feeling a lot of pressure down here. Usually when I hear that, I think prolapse, but I always ask, would you like me to do a pelvic exam and check? And I can find out if they have a prolapse. And then it's a different approach. It's learning how to sequence those muscles because the pelvic floor muscles are smaller. Your core is made up of your pelvic floor at the base, abdominals in the front, back muscles in the back, and at the top, your diaphragm. So when you activate your abdominals, your diaphragm, and your back, what you do when you lift or when you strengthen, and you're not activating those pelvic floor muscles, all it's doing is creating pressure downward. And since those pelvic floor muscles are small, they need to be engaged first before you engage the other larger muscles. And then they can contract stronger when the other muscles engage.
Yeah, it's almost a full shirt for me.
You're looking better than
Haley was like, that's funny. That shirt wouldn't even cover my bra. Yeah. Small torso probs.
One more, but stop too soon.
You know, I thought that was going to be a warm-up set.
For you? Is it 5 okay for you?
I doubt it, but yeah, we can try.
No, just 5. Oh, the one that was there before. Did you try them with the 5s?
Oh, yeah, I did. You mean you went up?
I was expecting to do like a couple and then be like, okay,
5s on each side.
not too shabby.
Take them off and 0.
Nope.
Just
Woo! Well, because this is what, like 45. Oh, that's why. What's 40?
kilograms.
30. No, the bar is 45 pounds.
Yeah.
I think so. 35-pound bar. So 30 times 2.2 is 65-ish. No, it's like 70-ish, isn't it? 30 times 2.2.
Yeah, that's fine. I just went back to something.
Yeah, so 67. Let's say 65 plus 45 is 110. That's not quite where I'm supposed to be at, like 130 for 80%.
Drive so that your arms
Okay, so now I want to do 45. 45 should be 125 though. I'm doing math wrong. Get it, girl. Look at Haley. For all of you who don't know, Haley tore her ACL and she has her surgery in a couple weeks. And she's power cleaning a dumbbell, which is nuts.
I was thinking, I don't have any pain.
Yes. Yep. And a little bit of an event
It's just so weird because I have no pain.
under it.
But all that stuff is torn. My ACL, my meniscus. I have some cartilage damage, which is really not good.
Like, that just feels like too much.
What else? Am I forgetting some? Oh, partial MCL tear.
Yep.
That one, if anything, bothers me the most, but I wouldn't even call it pain. But that's the one I feel, if anything.
What?
And that's just an awareness, my MCL.
Oh, MCL. Yeah, you've had the
It's
most
crazy.
pain with
I have
that.
nothing. I have nothing.
Because your meniscus is lateral.
Yeah. Nothing hurts. It's just beyond, I don't understand.
That's because exercise
Well,
is
that
some
too.
of the best medicine.
That too.
Motion
Amen.
is lotion. Okay, so let's dive a little bit deeper now into cases that we've seen of patients with pelvic floor issues. So before we had Nicole, I would refer out if I felt like someone needed internal work, and I would do more of the external work myself. Some of the cases that I would see where that would be appropriate would be if I'm dealing with a diastasis that is less than that, like usually 2 fingers or less. If I'm dipping into 3 fingers, I'm like, I haven't actually seen 3 fingers, to be honest. I've seen 2s. Girl, she needs help. I mean, if it's early, it's still better. That can feel so discouraging though if you're a mom and you're like, I want to address all this stuff, but like I'm just gonna get pregnant again. Why don't I just let my body fall apart? Well, not a great plan, because let's put it this way, like if you have a building that's falling apart and you're like, well, in about 5 years, we're actually going to have an event here. So then like at year 4.5, it would be good to remodel this building so it's ready for us to have this event. And it'll only take us about 6 months to get that building ready, right? Well, if you let weather and like animals and like everything get into that building and let it continue to deteriorate for another 4.5 years, you're basically going to destroy that building down to the point where you have to completely rebuild it. And it's not going to be ready in 5 years. It's going to be ready in like 6 or 7 years, because probably 6 years, because it takes a while to like rebuild everything. But if you're just replacing a broken window, the building can keep going, right? And it will make it there, and you'll spend a lot less money on it, and it'll look a lot better for a lot longer, and it'll be ready whenever you want it. So that's usually my thought process when it comes to like I'm planning on having another baby, y'all. But I didn't really want to stay like unable to play sports or pick up my kid without pain or peeing myself, or not be able to like feel active and like do the things that bring me joy just because I'm going to get pregnant again. Like I felt pretty much normal at 1 year. And sometimes that's when people get pregnant again. But even if I had, I would still be happy with where I am right now, because I feel like me again and I feel strong. And I don't want to just continue to deteriorate, because then it's like when I get to the end of having kids, it's like, oh, well, that mountain's too high to climb, so I'm just not going to do it. F that.
Well, the other thing is too that stronger muscles bounce back faster. And you're going to lose some. You're going to
This
lose
is why
some
she's
strength
doing this for her knee.
in both your pelvic floor and your abdominal muscles, especially in that last trimester of pregnancy. It's inevitable because those muscles are on stretch. So you want to have a little bit of strength to lose, right? I can say I have never in my 24 years ever seen a woman come back to me that learned how to activate her pelvic floor muscles while she was pregnant. I haven't had a patient come back to me afterwards with pelvic floor dysfunction if they've come and learned how to activate their pelvic floor,
which is awesome.
before they got pregnant or when they were pregnant.
Breathe.
That was beastly. I saw.
You're good. These were just examples. Just talking about stuff. Well, we haven't mentioned constipation yet. I saw a fair amount of constipation in my history. And first it was like, I'm out of my league. But with that as well, sometimes it's a miscoordination of those muscles and things cannot completely relax and release, which I think you've already talked about with incontinence as well. And what I found helpful is scheduling different, your bowel movements and working on that alongside manual work and relaxation techniques. So like a lot of our warm-ups, getting deep stretches and deep squatting in. I've seen some at the very young age where they are having diarrhea with that.
Oh.
So if you feel constipated, but you're having diarrhea leakage, it's probably all in there. It's ready to come out and it just can't.
Yeah.
Have you seen that a lot?
Not a lot, but I mean,
It's the same.
It's the same pelvic floor dysfunction. Yeah.
Well, and that's something too, like I wish I would have known about pelvic floor issues when I was younger.
Huh?
When I was in high school, I had some incontinence, like leaking, but it was primarily after exertion. Sometimes it would be with like jump ropes and like jumping activities, not with volleyball, but like if we were doing like tuck jumps or like squat jumps or something, I would have leaking. And I never had constipation or diarrhea issues, but even at 15 or 16, like I was dealing with incontinence, and that was well before I had a baby. And it would have been nice to know that like, hey, that's not normal, nor do you have to tolerate it as normal. And like, there's something you can start doing about it to help. So that way it's not that way all the time. Because part of the reason I probably had incontinence after I had baby, and I'm still dealing with it now with jump ropes, like if I do like crossovers or dubs in CrossFit, I've had to modify, and it's been a longer road back to doing those without leaking, probably because I've been dealing with this for like 2 decades before now, right? And I'm recovering really well. I'm really happy with my progress, but it's not all the way there yet. And it's just because like now I'm at the point like, do I care enough to actually work on it because I can do everything else? Or is there like, yeah, it's coming down to goals, right? Like, is this something I'm okay with living with because like I've found workarounds for it? Or is it something that's like, no, this is really getting in the way of my function and I need to manage it? Like,
Yeah.
I'm kind of at that crossroads, right? Like, not right now, but the reason I'm bringing it up is that if I had dealt with stuff that I was dealing with when I was a kid, I probably wouldn't necessarily be dealing with it as badly now.
But you have to understand knowledge is power. I tell a lot of patients who kind of beat themselves up because they're like, gosh, I've been doing it wrong all these years, but I'm like, it's not a personal failing. It's just that now that you know better, you do better, right? And it's never too late to strengthen your pelvic floor. Sometimes it's kind of sucks because you have to reduce your impact with exercise. You have to reduce your weight for a while until we can get your pelvic floor stronger. But it does get stronger, just like every muscle in your body. You look like you're going to say something.
Didn't want to hide behind here.
Yeah. I will say I'm a pelvic floor therapist. I've been one for my whole career, pretty much. And even when I hit perimenopause, I started having leaks. And I know how to do pelvic floor exercises, okay? Lots of things can affect your pelvic floor. It can be hormones, it can be stress levels. It can be if you've got a really bad cough for a long time, that puts a lot of stress on the pelvic floor. So, if you feel like, man, I've been doing my exercises and now I'm having leaks, don't beat yourself up. Things happen. I had to go through the program myself, get my body back on track, but I knew how, and that's what I want to do is I want to teach people how.
I've got one case that I'll talk about for some of our older ladies, and older is in like older than me. It's like 40s and above, which is not fair to say. I don't think you're old until you're 90. So when I say older, I just mean older than me. But I saw someone 55, around that area. 50. Her youngest baby was 20 years old at the time. She was dealing with chronic low back pain, chronic hip pain, fibromyalgia, like a lot of like total body pain. Had all the diagnoses of exclusion. Chronic regional pain syndrome, fibromyalgia. What's a diagnosis of exclusion? It's basically a diagnosis where the doctor's like, we don't know what's going on with you. You probably have this. We don't have a great way to measure it, so we're just going to call it this. That's what chronic pain, chronic regional pain syndrome, fibromyalgia, all of those are diagnoses of exclusion. Some people who are very niche down in that will say like, no, we have ways to test that. We don't really. We know that there are processes behind it, but we haven't been able to find that out until people are dead and we're doing autopsies. Kind of like Alzheimer's, like you can't test for it until they've already passed away, so you're looking at symptoms. So anyhow, came in with all these symptoms. I was trying to figure out what was going on with her. And it was very like, as we're doing testing, it wasn't reproducing. Like I couldn't get her pain to come back high or low based on exercise. So I started asking my red flag questions, which is like, have you gained or lost weight unexpectedly in the last like couple months? Are you unable to sleep at night because the pain's just all the time? Does it change with movement? Does it not? Have you gotten blood work done recently? I'm trying to think of other red flag questions. Those are my go-tos. Oh, history of cancer. Pain at night, yeah. Usually pain at night, and I can't reproduce it with movement. I'm passing you on. Or history of cancer and unexpected weight loss or gain. But she had none of those. And then I was like, do you have any kids? Yeah. Did you birth them? Yes. How old's your youngest? 20 years old. Okay, lay down. I start feeling her diastasis and doing some testing for that. And she's got a 2-finger separation. I'm like, okay, so we're dealing with that. And it was like 6 inches above the belly button, 6 inches below. And she had 4 kids and 2 C-sections. And I was like, do you have issues with leaking and constipation? Yeah, I do, actually. I've got issues with like, da-da-da. She did not end up continuing with me because I think she felt that mountain was too high, like to climb, to get out of that. But that was one where like the cause of all of those issues she was having was stemming from baby 20 years prior, like straight up. They were like, you have all these issues. No, you have unresolved weakness from your births, and it's led to this. I'm really sad that I never got to treat her because she would have done a full 180. If you guys want to, you can set up the barbells for overhead because we're going to do a push press and then push pull-ups or ring rows. So we can use bands or we can set up the rings for where we're going to do it.
One thing I love about treating pelvic floors is that the moment patients have that light bulb and they know how to activate their pelvic floor, it does not take very long for their symptoms to start getting better. And what I love about Inside Track is that I can be one-on-one with every single one of my pelvic floor patients. Whereas when I worked in an insurance-based system, I had to be in and out of a room with a pelvic floor patient because you're double booked. You got more than one person that you're trying to see it. Here, I can spend a whole hour with somebody and it's just beautiful because I can really educate and really get people on board with what they need to do with their exercises at home.
Sorry, Nicole.
Oh no, you're good. The backdrop of workout is good. Does this one not have a magnet?
It does. It's on the other side.
Oh.
No. The other standard. Behind you.
Okay.
Behind you.
Oh.
Behind you.
Oh. I see.
It has a magnet.
I thought it was magnetic.
Yeah, that makes sense why you're like.
I was like, why does it stick? Like trying to put something on my toes.
Overhead.
Lift a laddle. That's what my shirt says. For anybody who cares. It's a little axolotl and it says lift a laddle. I was showing them my shirt.
I like it.
Lift a laddle. I want to put this on some of our merch where it's like a little axolotl doing it and then it's like Inside Track PT. I think that would be funny. Okay, so, alrighty then. So how does this relate? How do pelvic floor things relate to exercise? So we talked a lot about like some daily life stuff, just like with leaking, with like being out and about and like picking up your kid. But if you're a runner or a weightlifter or a CrossFitter or a volleyball player or a basketball player, how do we help people get from I can't even laugh or sneeze without peeing myself because I sure as shit can't deadlift more than the bar? How do we get from there to like all the way back? Like where I am right now, I don't have, like I had incontinence after baby. I don't have any constipation, no diarrhea. I don't get any leaking except when I do dubs, which is something I'm working on. I can lift heavy weight. Like I just did 135 on power clean, not a leak in sight. I do not have a panty liner on right now. Like, how do we get people there? Because I would say, like, not everybody weight lifts. A lot of people run though, and they're just dealing with it. And it's not just like, oh, I finished my marathon and I peed myself because I'm exerted so badly. It's like, I started mile 1 leaking and I just like didn't even go to the bathroom because what was the point? So how do we get there?
Well, the good news is if you're not having leaks, unless you're doing something really high impact, like a double under or lifting a really heavy weight, that means you have a strong pelvic floor. Because anyone with a strong pelvic floor is not going to leak urine, or even their gas is not going to escape when they don't want it to, right? But you have to understand with high impact activities, even sneeze, cough, but especially with a double under or lifting a 1 rep max, you're putting just so much downward pressure on that pelvic floor. So your pelvic floor getting strong enough to do something like that, you have to look at it as a building block. You have to start from the bottom up. So ideally, before you even start doing that stuff, you have already understood how to contract your pelvic floor and when to contract your pelvic floor, because sequencing is what matters. But even after you start, you can still do it. You can still get them stronger. And I've had to tell some of my CrossFitters that they have to decrease their weights for a while. They have to go a little more low impact. It's sadness. I know it's sadness, but it's just so that in the future, I don't have to see you again because you're leaking. We build those building blocks. We build that support, and then you can launch from there. And for some people, it's not even a matter of they're leaking. It's that they feel like they can't make gains. And sometimes not being able to make gains also has to do with a weak pelvic floor, because without that strong base, it's hard for the upper muscles to continue strengthening.
Yeah, as someone who like went through that whole process, and I talk with CrossFitters a lot at my gym, like a lot of women at my gym, trying to get them to come in to see us because they're like, yeah, I pee every time I deadlift or every time I box jump. And I'm like, I know you don't want to take time off, and I know you don't want to decrease your weight because you feel like the rest of your body can do it. But listen, your body can't. And you're just a ticking time bomb for when the next injury is going to hit, or just being chronically injured and broken, getting to the point where your mindset's just like, oh, I can no longer lift. That's a bummer for me. I guess I'm just done. Or I guess I'm just never going to lift anything beyond the bar again. Like that causes a mindset of like, I am unable, and it's not true. Like, just because you don't know what to do doesn't mean you can't do it. And it doesn't mean you can't learn. Is it going to cost you time and money to figure it out? Yes. Is it stupid? No. Your perception of like, oh, I'm going to have to decrease my weight. And when people ask, how do I tell them? Just be honest. Like, create the conversation. I'm having pelvic floor issues. You don't even have to get into it. You can just say like, I'm having pelvic floor issues when I lift heavy, and I want to get past that because I want to hit new PRs. I want to continue to get stronger. I don't want to cap how strong I can get. I have bigger goals than just where I am right now. Because as a CrossFitter or a weightlifter, it can feel really dejecting when you stop getting better. Like when you get to the point where you're plateauing, you're just not getting stronger. That's just really frustrating. And a lot of times it can be because your pelvic floor is not strong, or you're still having leaking because you have poor control or you have constipation. So don't let that get in the way of what you do moving forward. Like when I came back from baby, I was lucky because I had head start, right? I started right when I had my kid, like right after I had my kid. I went down to no weight and it only increased and stopped when I started having leaking. Like if I was lifting and I had leaking, I backed down the weight. If I was doing a movement that caused leaking, I didn't do it. So that way I could build, so that way I wasn't building bad, like basically nervous system pathways saying like, every time I do this, I get this. Because I don't want my body to have the habit of like, every time I lift this weight, I pee because I can't coordinate my core control correct, which leads to other injuries. Many records I sell.
I feel like I've heard some things that people have been saying, and not, so I apologize if I repeat.
Yep, go
I
for it.
know last time we were here, we talked about how I think it was after we signed off, about lifting and like feeling at the end of a workout, or for me, with a lot of push-ups or a lot of heavy core contractions, having trouble, even though I don't regularly. And I think that brings you back to the heavy stuff, the double unders, and that topic you were already talking about. And you said, start that contraction before the lift or before you're doing it. So advice for you now, if you're not having a lot of trouble, but you're having a little, what would you say? Did I say it
Yeah.
well?
Yeah, I think so. And a lot of times when you tell people you need them to tone it down so that they can get their pelvic floor stronger, they want to know how long do I have to tone it down? I say, okay.
How long did it take you to get there? How long did it take you to get to the point where you were leaking everywhere? And how long have you been dealing with it?
Yeah. I usually say, I'll know more by your second pelvic exam. That's when I can know how fast you're getting stronger, how good your awareness is. But a lot of times it's going to take 2 to 3 months before you can do a single rep max.
And in the span of the 10 years or 5 years you've been doing this, like dealing with this and continue to have this bad reaction, not coordinating correctly, like we are rewiring your nervous system and also building muscle at the same time. 2 or 3 months is pretty damn good.
And you'll be surprised how the simple ass exercises I give you to do are going to feel difficult.
Yeah.
They're nothing like a CrossFit workout, but let me tell you, just remembering all the little things, pelvic floor, keep your stomach tight, breathe, then do the thing, maintain those contractions. It's a lot to think about. And if you don't practice it with those baby exercises, I call them baby exercises, you're not going to be able to do it with a hard exercise when it's all you can do just to get through it, right? Ah. Shit. Give me that black one. Maybe I'll try that. The black one.
Do it. Do it.
No, I don't think.
I think everybody, I think literally all of you could do a pull-up.
To be honest, I was being way too lazy to.
Well,
How much is that?
I don't know. I mean, this probably took off half or a third.
I need at least a half.
Try it. I mean, we've got bigger bands. Pull-ups make you look hard though, so I'm gonna do pull-ups. She said it's a strong band. Like that's why I pulled that out, because I was like, I can't even like get it down far enough to try it. Try and hang. Just try and hang first. Oh. I'm gonna step this back just a little bit so that way it's still behind you. You're not like alone, but get it, girl. Yes. Get it. Nice. See, I like to do pull-ups because I think they make me look cool. Like if I'm being honest. Right, exactly. I feel like I look cool. Yeah, it was 4 or 5. All right, y'all. Well, we don't have any questions right now. I saw a couple people listening though, so people are caring about this topic. We are gonna sign off and finish our workout. I still have 3 more sets. But we're gonna sign off, finish our workout. We really appreciate you watching this and supporting us. You can find us on YouTube, TikTok, Instagram, Facebook. We would love for you to follow, like, share, comment. The more that you do that, the more people see this in our community, and the more people can get help and stop getting bad therapy, bad advice. They can actually get better and get back in the gym, because that's the point of all of this, right? That's what we want. We just want you to feel better. We want you to enjoy working out. We want you to live to 70 to 100 whenever you want to die and feel comfortable and with it and capable the whole time. So if that's your goal, and you might want to like lift some weights and run some mileage in the middle of that, or play a sport, then let us know, because we can help with that too.
Yeah, and if you know somebody that needs our help, come see me.
Yes. If you know someone that is dealing with pelvic floor issues. In fact, I said this in one of my groups the other day. If you know a woman who has had a baby, you don't have to get detailed. Like, you don't have to be like, do you leak every time you sneeze? Like, there are signs. Achoo. Oh my gosh, I'm laughing so hard I'm gonna pee. Oh my gosh, my back hurts every time I pick up my baby. Ugh, lifting the groceries. Can you help me with that? Like, doing one at a time just kills my hip. There it is. That's your sign. Point them in this direction so we can help them. Come say bye.
Bye. Bye.
Thanks for watching.
Good weekend.
Have a good weekend. Oh, we won't be here next weekend because Haley and I are going to be at a business conference, but we will be here the weekend after that.